Well, hello everybody. I'm Dr. Kale. I'm here with Kristin Bacco. This is part of the a series of the for the Breast Podcast ever. We are here to talk about managing complications during the breast reconstruction process. So let me introduce everyone to Kristin Bacco. Thank you so much for being here and willing to share your story.
Thanks for having me.
Yeah. So, let's just jump into things. So tell us, how did everything start for you?
Well, I was diagnosed with stage 2 breast cancer, and I had some genetic mutations which led to my discovery of it. So with that, with the three mutations, it was kind of like a clear choice for me to do the double mastectomy to start with, uh, because it could lead to reoccurring breast cancer. So that was kind of like a no-brainer for me to make that choice. And then adding in the tissue expanders was also kind of like a no-brainer for me personally, because I started with size D breasts. So going to a full flat chest after that was kind of just a little too nerve-wracking for me.
Okay.
So that's why I went with the tissue expanders.
So just give us a little bit of background. So I know that I know that, yeah, and as you know, and as people who are interested in reconstruction, there were many potential types of reconstruction that we could do. Now, when you started in the initial discussion during the reconstructive process, had you already decided, that you would ultimately want implants or tissues? Um,
I'm kind of leaving that up to all of my doctors to guide me in that decision.
okay.
It was just more of the like being flat chested that scared me the most, I guess.
Okay.
Um, so that kind of guided me with that decision.
Got it. Now, just to share with everyone, you did ultimately need radiation. Is that correct?
Yes,
Uh,
just in my left breast.
just in the left side. So,
Yeah.
had you known that before the mastectomy, or was this something you found out afterwards?
That I needed radiation?
Correct.
Yes, I knew that from the start that I needed that. I didn't
Okay.
have any idea what that meant because I had to go through chemo and surgery before the radiation.
Okay.
So that's kind of that was the third part of my journey that I didn't really know much about until it was happening.
Got it. Um, Now, just to give folks who are listening just sort of a little bit of background, um, from our standpoint, the radiation could tend to limit that initial choice between using tissues and implants, from the very get go at the time of the mastectomy. Can you just, is that something that you remember talking to us about, sort of how radiation would impact sort of the sequence of the reconstruction?
Um, yes and no. I kind of don't really remember too much of it.
Okay.
But yeah, it was more like what was told to me versus like what I experienced. I didn't know what I was going to end up with, like with radiation. So it was kind of like wait and see kind of thing.
Sure. Sure. Um, so yeah, I would say, for for us in our practice, like typically we usually start with expanders when we know someone needs radiation. And so in your case, I think that's probably also another factor why we started with radiation. I mean, we started with expanders. So walk us through that step of the
Can
process,
you stop and go downstairs, please? Thanks.
and we can edit that out. So
Sorry.
yeah, it's no problem. Let me start with the question again, which is, so tell us about your experience with the mastectomy and the expander reconstruction?
Okay, so with the expanders at first, they were a little uncomfortable, to be honest. It was a little just getting used to something being just just a little uncomfortable, I'll just say. It took like it was like resting on my rib cage a little bit, and so there was a little bit of uncomfortableness in the beginning, but then, as time went on, it got easier, and it could have just been from the whole major surgery of it all. That was just the whole thing was just tender.
Okay.
Um, but overall, yeah, it
Okay.
was.
So just to kind of recap the timeline, you had your diagnosis. Um, we you had already started with chemotherapy. You had already known that you needed radiation before any surgery. You had the mastectomies. You started with expanders, and then you started radiation. Yeah.
Yes.
What was that like? Like, what was that like, sort of preparing for radiation? What was it like during the process? Um, what were you told that radiation would do and how it would affect your tissues?
So it was the radiation part was kind of difficult because I was told not to lift my arms after surgery for I forget how long it was. So trying to push myself because during radiation you have to like have your hands above your head like this, and that was kind of a stretch for me to do, like pain wise. It was pushing myself to the limit to like get my arms above my head to sit still through the radiation portion of it. Um, so that in and of itself was a little difficult. But after the radiation, I didn't really have like some people got like red skin, and I didn't initially have any of that happen until like a few weeks after I was completed with my radiation, which I think I had about 20 radiation sessions.
Okay.
So then after that is when I started seeing more red skin on my left breast, which is the one that was radiated.
Okay. So you had radiation for 5 days a week for 4 weeks total. Does that sound about right?
I think it was, I don't remember the schedule, but I think it was twice a week, maybe,
Oh,
or once a week. Yeah, well, I think it was for the whole month of November and partially into December, I believe. So it was like 6 weeks, I believe.
6 weeks. Okay.
Yeah.
It was daily.
Yes.
Okay. Okay. So, like, you're bringing up something that I find with our patients is really important, is that a lot of times that redness happens after you're done with radiation.
Yes.
So,
I didn't like any markings or any like there was no tenderness. There was really I didn't feel anything during the radiation process. It all happened afterward.
like, when exactly after radiation did you start experiencing redness?
Probably like 2 weeks after, I would say.
Okay. And, like, how did it progress from that standpoint after
Um,
it's
so like I said, it was like I had to push myself to raise my arm, my left arm over my head, and so I was able to do it during radiation, but then about 2 weeks after, my left breast started to get kind of pinkish red, like the whole thing, not like one isolated area, like the whole breast started turning like pinkish red, and it started to get like more like harder for me to like lift my arm. Like it just felt tight all through here. And so like this breast felt like it was expanding even more to like make it even tighter, which might have to do with like I thought it was the tightening of the skin that everybody told me might happen during radiation. But it was like getting tighter and tighter and tighter. It felt like, and like my skin felt like it was not, uh, like the expander felt like it was too big for my breast at that point.
I see. I see. So after it started, like walk us through kind of what happened next.
So when it started affecting how my arm was working, that's when I was like, I should probably listen to my body and something doesn't feel right. So that's when I came back into your office and said, this just feels overall really tight and it's affecting how I'm able to like lift my arm fully. And so I got put on antibiotics for a week and then I came back a week later to your office, and that's when we decided to do the surgery of the removal.
Right. So just to kind of give everybody a little bit of background, I think at that point we were concerned about an infection in that breast. Um, so, um, unfortunately, like that is a complication that can happen after radiation. And as you mentioned, we did have to remove that expander. So I want to spend a little bit of time here because, the focus of this conversation is, what do we do when we experience a complication during breast reconstruction? So, walk us through that day when you knew we were going to remove the expander. Like what were you feeling? What were your
So
thoughts?
So it was a Friday afternoon, I think early afternoon, and you examined me and then asked what I was doing that Friday night. And I was like, I don't think anything. And you were like, well, let's remove that tonight. And so we went into I went through the emergency room at that point, and we went through and did the surgery later that Friday night.
Yeah. So it definitely happened fast. Um, you know, just to just to give everyone my perspective on what was going on, I you had a pretty bad infection, which um, I was afraid would get worse if we sat on it. So we did go to surgery right away, and like, what were your thoughts? What were your feelings about losing that expander on that side? Like, what were your thoughts at that point in time in terms of like how it would impact your ability to have
Well,
reconstruction?
I definitely felt like it definitely needed to be removed,
Okay.
because it was definitely causing some issues in my like just normal activity with my arm. So like having it removed was definitely a relief. Um, but as to what it looked like after, I really didn't know what it was going to look like after until I saw what it looked like after, and then I realized how bad the infection really was.
Right. Um, so, at that point, like, what were your thoughts about like your ability to move forward with the reconstructive process?
Well, it felt like at that point it was at the bottom of the barrel as to like, I hope it can't get any worse than it looks right now. Like it looked so bad that I'm amazed as how the result came out after my deep flap surgery.
Um, Now, for obviously, like with having had radiation, having infection, there's a lot of scarring. That scarring, as you mentioned earlier, it's not the most exciting thing to look at after surgery. For patients, unfortunately, this is not something that happens every day for someone who's had radiation, but it's not so uncommon where we're taken by surprise by it. So, unfortunately, there are other patients who may experience similar things. So, like, what kind of advice would you give someone who has to have their expander removed? Like, what kind of advice would you give them in terms of like how to manage just immediately after surgery, but also like emotionally? Like how did you uh, manage that during the time period?
Emotionally, that was a little tough one, I guess. Just because it just looked terrible. It was lopsided, to find clothing or a bra even to help just support the one expander, but yet have a flat chested side on the other side. Um, I used the bra in pad inserts to kind of help even it out, but it was still kind of noticeable in shirts and things. So during that time, it was a little just, you know, I would say just I kept to myself a little bit more during that time, just for my own confidence level, I guess. So it was a little challenging, but luckily it was like during the winter months and it wasn't that big of an issue for me, for sweaters and coats and things. But overall, I would say that like having a the bra pads to like help even it out was definitely helped me just
Okay,
emotionally, confidence level wise, just to get through the time period to have it heal and get on to the next surgery.
right. Um, is there anything that else that you would recommend as far as like patients who may have lost their expander after radiation infection? Is there anything you would recommend for patients going through that?
I would say that I definitely kept moving, like physically doing exercises to help my arm and to like, because I felt like just from the double mastectomy surgery on, I just had like my left arm just felt I needed to keep stretching it and keep working it. And the more that I just sat there and didn't keep moving, that's when it would hurt more. And it just I needed to keep moving, and still to this day it feels better when I keep exercising. And I looked up YouTube videos. There's one in particular that was uh, cancer treatment PT or cancer rehab PT that helped with the physical therapy part of it. So I have three small children, so going to physical therapy was just a little too time consuming. So I did it on my own and just pushed myself to do that, which really
Okay,
helped. Just to help with my emotional mood too, just to be able to physically do things on my own and not have my husband help and that kind of thing just really helped, to
okay.
be more independent again.
Would is there anything else you would recommend for patients in terms of beyond sort of physical activity, like just kind of keeping in social contact with their community, or like any other forms of like support from family members? Did you find any of
I
that?
definitely had support from my friends and my family. I didn't really reach out to any other like cancer communities or anything like that, but I definitely had a good support group with my friends who helped joke about things and just keep it a little more lighthearted to, get me through it and know that they were there to, help support me.
Okay. All right, so obviously that was a really like it wasn't an easy time, and then kind of after we got on the other side of the infection, uh, what was your thought process when we were deciding kind of what the next steps were to reconstruct both of your breasts?
I think that we decided that we wanted to focus more on just reconstructing my damaged breast first. And I don't have a whole lot of extra tissue to be able to build both breasts. So we decided to just focus on the left one, which was with the damaged, radiated breast.
Okay.
So, that's when I decided to do the deep flap surgery just with my left.
Okay. Now, if you look at sort of that moment where we're deciding what to do next versus your initial thoughts about reconstruction at the very beginning of your diagnosis, did you feel um, like did you feel um, how would you reconcile sort of like our decision at the point where after you had lost that expander, we kind of knew we had to do tissues versus kind of in the very beginning, like did you have an opinion of implants and tissues, and now that we knew we had to do tissues on that one side, like did you find that difficult in terms of like your initial opinion versus what we needed to do?
I think initially I think I wanted to do the tissue from the beginning.
Okay.
Um, I think I initially was more for having my own tissue and the
Okay.
less likelihood of having an implant like rejection or anything like that. I just was more comfortable with using my own tissue at that point.
Okay.
Um, so
So for you, it wasn't too big of a deal to know that, like, the side that we lost the expander, we had to use tissues.
no, that was I was okay with that. I guess the after I found out that there wasn't going to be enough tissue to do both of my breasts, I think that's when I was like, oh, okay, so what is the solution then?
Okay.
Um, so I feel like I still made the right decision with doing the deep flap surgery with just doing the one side.
Okay. So we ultimately used your entire belly for just one breast, given sort of what had happened. And then, we ultimately decided upon an implant for the other breast, which wasn't radiated, which didn't have a problem. Like, what are your thoughts in terms of how did you reconcile having to have an implant on the one side versus having tissues on the other side versus your initial desire of wanting to use tissues for both breasts?
I guess actually our meeting when I actually felt the implants and they weren't, I guess in my mind it was like focused more on what the tissue expander felt like. And I was like, I don't want that.
Okay, okay.
Because I don't know, there's like a hard side on a tissue expander. There's like a back to it, and like an implant felt a little more natural. And after I felt it in my hand, I was like, oh, okay, this isn't as terrible as I thought it was going to feel like. It was a lot, it eased my mind a little bit after I held them in my hand and felt what they felt like.
Okay. Um, so now we've gotten through the deep flap. We've switched out your other expander for an implant. Like, how do you feel they both match? Having one side being an implant, the other side being a
Um,
tissue-based reconstruction.
I feel like they're pretty similar. The tissue one, I feel like has a more natural shape and feel to it, but I feel like the implant, it also feels pretty natural. The only difference that I can tell is that the weight of them is a little different. Like the tissue just feels more natural. It's a little perkier than the implant is a little just heavier, if
Just
that
heavier.
makes sense.
Yes,
Yeah.
yes, makes perfect sense. Um, in terms of like how you feel about yourself now that we're on the other side of the reconstructive process, like how do you feel knowing where you were at that one point in time where things look pretty bad versus where you are now?
I feel great. I honestly feel like it couldn't have been better. I feel like it went beyond my expectations of like it felt pretty grim there after the infection and after the removal of that. I was like, oh, how is he ever gonna fix this? It's impossible. But yes, I'm very happy with how it all turned out. And yes, I feel confident in like wearing any clothes that I normally would have worn before all of the surgeries. So definitely more comfortable in my own skin again.
Well, great. I'm so happy to hear that. Now, just give our audience just an overall view of like how long was this entire process from the time of your initial diagnosis to the time of your most recent surgery?
So I got diagnosed in February of 2022, and this final breast implant surgery was in September of 2023. So
Oh,
almost a full year and a half, year and 8 months or so, almost 2 years, I would say,
okay.
from beginning to end.
And how many surgeries do you think you had over that time period related to treatment for your diagnosis?
Um, I had about 8 to 10, I think.
Okay.
Overall, like not just breast surgeries. I had my ovaries removed and other things like that by port and put in and things like that. So probably 8 to 10 surgeries with probably 3, 4 major surgeries, I would say.
It's quite a journey for sure. Um, what would you say to people who are about to go through this process that may have sort of similar treatment needs as you or who are in the middle of it? Like what kind of advice would you give our patients who are listening?
Um, Just be patient. It's not going to happen overnight. It takes time for your body to heal in between each surgery. But also push yourself because nobody's going to do the work for you. So exercising and just keeping your arms and things moving whenever you're allowed to. That is, don't overdo it like right after surgery. Um, the drain part was probably the one that I feel like was like a curveball of
Okay.
trying to get used to those. That was like I was like I have to do this on my own kind of thing. But once you get the hang of it, I had a few drains along the way, but that was probably the one that was like a little nerve-wracking, I would say.
Sure.
Uh, But overall, just try to stay positive, I would say. Don't let it like overwhelm you with despair.
Yeah. Well, that's really great
'Cause-
advice. And Kristen, I just wanted to take the time to thank you. It was quite a journey for the both of us. So I just want to thank you for taking the time to share your story with everybody. Um, I know that there were moments where it was tough, but you made it through, and it was such a pleasure to work with you.
Yes, I agree, and I couldn't be happier. So I appreciate all of your hard work and the time that you put into my particular case. I greatly appreciate it. So
Yes. All right. Well, thank you very much, and thanks everybody for listening. Um, Kristen, I just want to thank you again. Thank you so much.
thank you.